Good morning. My name is Dr. Arpan Phillip. I'm the Associate Medical Director at Parker Jewish Institute. This morning, I'd like to discuss about heart failure and its management. So what is heart failure? Heart failure is a condition that occurs when the heart cannot pump blood as well as it should. This leads to inadequate blood flow to the vital organs, such as the kidneys, the liver, and other organs in the body, and it leads to congestion, which is a buildup of fluid, which can result in the term heart failure. The term heart failure is misleading because the heart does not completely fail or stop beating. In some cases, heart failure can be mild and cause only minor symptoms that are only evident with physical activity. On the other hand, at other times, it can be severe, causing symptoms even at rest, or even can be life-threatening. The most common symptoms of heart failure are shortness of breath, fatigue, swelling in the legs, and other signs of fluid retention. Although heart failure is a serious condition and very common, there are safe and effective treatments which are available. Treatments can improve your quality of life by relieving symptoms and even help you live a longer life. Now, what are the causes of heart failure? So one of the most common causes is high blood pressure. In people with high blood pressure, also called hypertension, the heart has to work that much harder to pump the blood. Over time, this increased workload, we're talking about years, can reduce the heart's ability to relax and fill the chambers with blood. One of the other causes is something called coronary heart disease. What is coronary heart disease? Coronary heart disease is a buildup of plaque in the arteries that supply blood to the heart itself. This can cause it to become clogged and reduce the blood flow. As a result, portions of the heart muscle are deprived of vital oxygen, especially during exercise or when you're exerting yourself. And because of this, the heart cannot function as well. Coronary heart disease or coronary artery disease can also lead to, which is very common, a heart attack, also called a myocardial infarction. If an artery becomes completely blocked, this can cause permanent damage to the muscle of the heart. Coronary heart disease can lead to heart failure when it impairs the function of the heart. The third cause, a condition called cardiomyopathy. This is when the heart muscle does not pump or relax normally, but the cause is not high blood pressure or coronary heart disease. Now, cardiomyopathy can be related to a whole host of different medical conditions, including certain autoimmune disorders, a genetic mutation, or an infection. However, often the cause is unknown. Another cause, heart valve diseases. Now, heart valve diseases, that refers to a number of conditions that can damage the heart valves, which normally keep blood flowing through the heart at the right pressure and in the right direction. Now, I'm going to discuss heart failure symptoms. What are the most common symptoms that you should be aware of? Number one, shortness of breath. This is a condition which might require you to cut back on your normal activities or sleep with several pillows to elevate your head. You feel tired, you feel fatigued very quickly, even with minimal activity. You feel weakness, particularly in your legs when you exercise. Lightheadedness or even dizziness. You may have palpitations, rapid heart rate, swelling in your lower extremities of your legs, or even the belly. So, how do we diagnose heart failure? So, heart failure diagnosis is based on your medical history, a thorough physical examination, and a series of blood tests. These tests can tell your physician how well your heart is working and can help determine the cause of your heart failure. What are some of the common tests that the doctors use to diagnose heart failure? Number one is a simple test called an EKG. This is a non-invasive test, which is a measurement of your heart's electrical activity. An EKG or ECG may detect conditions that can cause heart failure, such as abnormal heart rhythms or sometimes even a heart attack. Another test that the doctors can use is a blood test which checks for BNP, which is a hormone produced by the heart. When a person has heart failure, the BNP levels may be elevated, higher than normal. We can also do a chest x-ray. The chest x-ray will show us the size and shape of the heart and the large blood vessels in the chest. It can also show if there is any fluid in the lungs, which can happen in people with heart failure, as I mentioned earlier. Now, another common diagnostic test is an echocardiogram. This is also a non-invasive test where they use ultrasound, high-frequency sound waves, to assess the size and the function of the chambers of the heart, as well as the structure and the function of the valves. This includes measuring how well the heart muscle pumps, what's called the ejection fraction. Now, a follow-up echocardiogram can be done to see if there's any heart function changes over time. Another test that's commonly used is what's called an exercise test or an exercise stress test. This will determine how well your heart performs during exercise. It is one way to look for signs of shortage of blood supply to the heart caused by blockages in the coronary arteries, as I mentioned earlier. A cardiologist or a nurse will see how your heart responds to exercise by looking at the EKG, blood pressure, heart rate as you walk or run on a treadmill. In addition, imaging tests can be done to measure the effect of exercise on the heart. Another test, which is a little bit more invasive, is called a cardiac catheterization. Now, a cardiac catheterization is done by an interventional cardiologist. This helps to measure how well the heart is functioning and provides an actual picture of the coronary arteries to look for blockages. During this test, the cardiologist inserts a thin tube called a catheter through a large blood vessel in the groin or your arm, and then advances it into the heart. Subsequently, a dye is injected into the catheter to view the arteries and the structure of the heart by X-rays. The pumping function of the heart can also be assessed during catheterization. Some of the other imaging tests that I will mention that are used are CT scans, MRIs of the heart, and nuclear scanning studies. Doctors can look at all of these studies to help them visualize the structure of the heart and the coronary arteries. For example, an MRI or a nuclear scan can detect inflammation of the heart. A CT scan is sometimes used to examine the coronary arteries to look for disease. Now, the next section I'm going to discuss is heart failure treatment. In most people, heart failure is a chronic, long-term condition which can be effectively managed. While there are treatments that can help with symptoms and slow the progression of heart failure, in most cases, it is a chronic condition that requires lifelong treatment. Treatment usually includes a combination of changes to your diet, your lifestyle, medications, and sometimes a device to protect your heart from abnormal heart rhythms. When we talk about diet and lifestyle, we're talking about changes in diet and lifestyle that are often recommended to treat heart failure. The most common include monitoring your weight, to monitor your fluid levels, to see if you're building up with any fluid. You will need to weigh yourself very frequently at the same time and on the same scale. For example, in the morning after you urinate, but before you start breakfast. Be sure to wear the same amount of clothing each time you weigh yourself. Now, if your weight increases by 2 pounds in one day, call your doctor or nurse. Also, if your weight increases by 4 pounds in a week, do the same. Now, gaining weight suddenly is one sign that you may be retaining more fluid than you should be. Now, other lifestyle changes include decreasing your salt and water intake. Salt in the diet can cause your body to retain excess fluid in the circulation, in the lungs, and elsewhere. Therefore, limiting the amount of salt, also known as sodium chloride, in the foods that you eat can help you keep heart failure under control. Ask your doctor how much salt you should eat. The amount of fluid you drink is also very important. For people with severe heart failure, doctors often recommend drinking less than 2 liters, which is 66 ounces of fluid per day. This includes water as well as all other fluids. Your doctor might give you more specific guidance on fluid intake depending on your particular situation and medical condition. Now, maintaining a healthy weight. If you are overweight, your heart has to work that much harder to supply blood to all the organs and the rest of your body. Maintaining a healthy weight reduces the strain on your heart and also helps you to feel better. Very important, avoid smoking or stop smoking if you are smoking. Cigarette smoking increases your risk of having a heart attack and can worsen your heart failure. If you smoke, talk to your doctor or nurse to get you help quitting. Limiting alcohol. Now, drinking too much alcohol is not good for you or your heart or for your health in general. People with heart failure should not drink more than 1 serving of alcohol per day. 1 serving of alcohol is about 12 ounces of beer or 5 ounces of wine. If your heart failure is related to drinking too much or is severe, you should stop drinking completely. Regular exercise. If your symptoms allow, exercising most days of the week can help you improve your cardiovascular health and fitness and strengthen your muscles. As a result, this can improve symptoms like shortness of breath and fatigue, which are common in people with heart failure, as I mentioned earlier. Becoming more active can also help you to feel better. Before you start a new exercise routine, talk to your physician or nurse. They might recommend a cardiac rehab program, which is a personalized approach to exercising safely to improve your heart function and overall health. Very important, medications. Medications are often used to treat heart failure symptoms. Some medications have even been proven to prolong life. It is very, very important to take your medications on time every single day. Some of the medications that are often employed to treat heart failure and to maintain quality of life include diuretics, ACE inhibitors, ARBs, and beta blockers. When taking these types of medications, it is very, very important to have regular blood tests to check for potassium levels and other electrolytes to make sure that your kidneys are functioning properly. Now, how to care for yourself. Being diagnosed with heart failure can be frightening and stressful. There are some things you can do to manage this condition. Number 1, be sure to take your medications as instructed by your physician. Do not skip doses, even if you feel better. Number 2, tell your physician if your medications cause you any side effects or other problems. Your doctor might be able to switch you to another medication or lower your dose to avoid bothersome side effects. Now, your healthcare provider is the best source of information for questions and concerns related to your medical problems and management of your heart failure. Thank you very much. Have a good day.